Hello people, in this video let us look at how to read anatomy, how to approach it. So basically, anatomy you have general anatomy, then you have upper limb, thorax, head and neck, right, brain, neuroanatomy, which forms the paper 1 for your exam, and paper 2 there can be lower limb, abdomen, pelvis, etc. Okay, so you have gone through the previous videos, right, where you have seen the syllabus, etc. Now more it is a technique of how to read anatomy, right? So basically, general anatomy is not at all difficult. You will be able to manage, and every time you look at systemic anatomy, you will be able to revise general anatomy. So let us look at upper limb now. Now upper limb, etc. you have seen in the movies how they draw on their hands and yes, or whatnot is shown. So what should your approach be to learning anatomy? So basically, you should know first of all from your question bank. So you get kind of previous year question papers, question banks you get, okay. So look at them, look at the important questions, take the priority and read only the high priority ones, okay. And when you are studying, you should be drawing diagrams, draw diagrams and practice these diagrams, right. You draw, every time you are studying anatomy, you should not be reading, you should be writing, you should be drawing and fill your paper fully with diagrams. And do one thing, if they ask you, for example, let us say, if they ask you carotid triangle, okay, first what you do in the exam, this is what I used to do anyways, draw the diagram, okay, draw the diagram, fill the diagrams, okay, then what you do, you start filling the theory. Just look at the diagram and fill in the theory. That is how I used to do it. It's up to you how you would like to do it. So when you're reading anatomy, you should not be reading, you should be drawing. Put this muscle. Okay, there should be a blue line here, there should be a yellow line, then should be a red line, and this red should be like this, and then like this, and you label it. Now you have the picture in your image, write the theory. The thing is, anatomy is diagrams. If you have practiced the diagram, it's very easy. What else would we like to tell here in anatomy? Right, similar things only. So you might have like this only paper 1, paper 2, very similar things you may have. So basically priority questions you should know. You should practice diagrams, right? Diagrams are everything. If you have learnt diagrams, it is everything. What else would we like to say here? For some important topics, like let us say some important topic is there. For that you should know everything. Like the venous, venous drainage, you should know lymphatic drainage, you should know nerve supply, you should know applied anatomy. Always end your answer with some applied anatomy. Like what could be the applied anatomy of this anal canal? It could be hemorrhoids, right? So you should end it with a clinical note as to why you are reading this anatomy, why would it be important, that kind of thing. And just another trick which personal again is that learn all the right side diagrams, only right side diagrams, right? And whenever you are drawing diagrams, you should know, like let me give you an example here, like when you're drawing this kind of a urinary bladder, which view are you looking at? Right? So this kind of looks like, you should know here that this is the anterior, this is the posterior, this, so this side whatever, this is anterior, posterior, right? And you're looking at the person, how he's standing something like this, right? So you should know this is the perspective, this is the angle you're looking at. So when you are making your notes, you should make this type of notes. When you're drawing, you should always draw A, P, and I always draw the man's face also. So I know which angle I'm looking at the man. Okay. Usually, whenever we draw things, we draw it in such a way that we are looking at the patient. Like let us say the heart, right? You always draw heart in a certain way. Why you are drawing heart in a certain way? Right? Why are you drawing heart in a certain way? Let's go to heart and see. Like, why is heart always drawn like this? Because you're looking at the patient, okay? So always the right is this side and the left is this side. You're looking at the patient, okay? And why we are drawing images where we are looking at the right side of the patient, right? Why is that? Because you should stand at the right side of the patient during examination, right? So there are a lot of things. You should always learn in that way. Learn the entire right side images. You'll be able to learn the left side part automatically, okay? So what else? Let us look at some practical stuff now. Practical embryology practicals, basically you will have to have the models, right? So models you will be having, and you will have to learn the models, you will have to learn about the models, all this. So your college may give you ready-made information on these. Embryology, look at the marks distribution, it will not be much. So you learn only the high priority embryology stuff and also the models kept in your college. So otherwise you will not need that much of embryology. Only when you need, that time you can read that part of embryology. Basic stuff of embryology like the arches, everything you can understand. Like you can look at the arch here, right? So the arches, so exactly what they do, the fate of the cartilages of the pharyngeal arches. So these are all basic things that you should know. Okay. Let us look at the genetics part of it. Now, genetics part of it, very specific things only you should know. Don't buy any book for genetics. I feel you can just manage off with certain few information. Maybe you can make your own notes, right? If you want to buy a book, it's up to you. We don't want to give any judgment here. So you should know some things like Klinefelter syndrome, Down syndrome, Turner syndrome. Basic things you should know. Pedigree chart, if you need to know, you can know. Okay. For autosomal, recessive, autosomal, dominant, allosome. So let us see histology. Now histology, very difficult, right? You should know these slides. You should be able to identify them. Just look at this and you should be able to say cerebrum, how will you do this, right? So basically by practice you will get it. It will not be so difficult because it is anatomy. It is all normal stuff, okay? They are not giving you some pathological slide and saying that it has full of disease, right? At least this is basic. You have to just identify the organ. It is not going to be difficult, okay? This is epididymis if you are not sure. So basically anatomy is much easier. The anatomy slides are going to be much easier than the pathology slides. So don't get very worried. By practice you will get it. If you get one or two wrong, it's fine. You will have gross discussions like they will give you an organ and you'll have to explain it. I got lung in the exam and I was not that prepared. So anyways, I could just pull it off, right? By the theory that we had studied, the lobes of the lungs and etc. Osteology, guys, when it comes to osteology, you might be asked to articulate the rib to the vertebrae, all that you should know. Osteology is not so easy, right? In fact, people don't like the fibula. Anyways, it is up to you. Practice more on osteology. Draw diagrams, take a bone. I had these kind of synthetic bones on which I had written the muscle names. When it comes to radiology, guys, basically your college will give you a set of images, X-ray images, only those if you practice it's enough. Basic things only they will ask in anatomy first year, right? You should know like the sinuses, right? Which sinus, all that. Right, you should be knowing certain things, basic things, like what a contrast X-ray is. So the X-rays could be plain X-ray or contrast X-ray. You should know for contrast what exactly is administered to the patient, etc. Okay. Then what about spotters? Spotters, read from Chaurasia, guys. Chaurasia has spotters at the end of every book. I think he has given spotters. Read them. Okay. Coming to surface marking, actually, you should know surface marking basically. It's kind of difficult to go into so many details of the measurements like centimeters and all. Main things you learn approximately, you learn first. Main things you learn. Surface anatomy is also there in Chaurasia. So what else do you want to know for how to read anatomy? What else would you like to know? So we will conclude saying that diagrams. No reading anatomy just by reading. You should write. You should draw. That's it. Okay. Bye-bye.